why you join a postgraduate course in conservative dentistry. Then in your journey, you will be attending many scientific meetings in the form of conferences, where the conferences are conducted across the country and across the globe, and also seminars and periodical on your regular intervals, which you are performing in your institution as well as in the interdepartmental meetings of your institutions. Third, to promote academic activities through the voluntary help of postgraduate departments of conservative dentistry and endodontics in various dental institutions in India and abroad. This is a voluntary work which is carried out by your department faculty or the other institutions wherever globally, any part of the country, if they are taken up, you will be allowed to attend them if you are the member of Indian Association of Conservative Dentistry and Endodontics. To propagate and work for suitable public health measures for the prevention of dental caries. This becomes always our primary responsibility, working for the prevention of dental caries in our specialty, and also to arouse the interest and consciousness and possibly impart instructions to the public in oral hygiene. Of course, this is also our social obligation when you become the conservative dentist and endodontist. Second, to print and publish journals, periodicals, articles, and other literatures relating to problems, practice, methods, exchange, and other matters relating to conservative dentistry and endodontics with specialization in the subject concerned in India and abroad. Of course, this is one of the important area. Today, if you have to prove that you are better than your colleague or the other conservative dentist, it's so that your publications and your articles which are published in the different journals, local and in the international levels, that speaks about your strengths and weaknesses. So, dear friends, from the day one, you start documenting whatever you are doing in your day-to-day working, whether it is a clinical work or whether it is a literature, you have to document. You do not have a choice. To represent officially the views of the members of the organization on all matters affecting or likely to affect the study and practice of conservative dentistry and endodontics in India to Government of India and different state governments, foreign governments, Chamber of Commerce, municipalities, local boards, universities, or any other public or private authorities. What does it mean? This particular slide has a lot of responsibility in the shoulders of the body of IACD or Indian Association of Conservative Dentistry and Endodontics. In the journey of our specialty, we have come across many problems which are being already represented to the Government of India and or the local state governments, or if required, sometimes when you are traveling abroad for the international conferences, some foreign governments also require a help, and also the other local bodies and universities, particularly in the curriculum reforms, etc., etc. The academics, what we had when I passed out masters in 1994 is different from today's scenario. So the continuous upgradation of the subject and the topics and the clinical skills is mandatory. So it is only possible with this help of our specialty continuously sending the modifications request to the Dental Council of India and various universities by changing the curriculum modification. So it is not possible without the help of our organization contributing to the continuous modification of our specialty. Our specialty has an office bearers, and office bearers, the positions are having one president-elect, and also has a secretary, 3 vice presidents, and executive committee members, currently around 17 to 20, which are continuously modified according to the numbers which are increased on a regular basis. Okay. However, we also have an editor, and we have an newsletter editor and a treasurer in office along with the joint secretary. These are the office bearer positions. Contribution towards the students. IACD has conference, convention, and CDE updates. These are the activities carried out on a regular basis. How does these conferences help? Learning is a continuous process, and we at IACD keep abreast with the latest happenings in endodontics and restorative dentistry by encouraging and conducting various conferences, conventions, and continuing dental education programs. This is the only way where you can update their postgraduates I am very sure a lot of things happening in your department in the college level, but when you go to the conferences, you are listening to many of the international speakers and the local eminent speakers who have done excellent work in the different areas. Second, along with didactics, promote interactive learning like live demos and hands-on courses where the attendees not only virtually immeable but also actively participate in the new concepts and protocols. Members are updated about the conference, convention, and CD activities over mails, SMS, and Facebook page and official website. All these things are carried out by our specialty, that is particularly our body, the president and the secretary. Now we are seeing the dynamic secretary, Dr. Mohan Kumar, who is doing wonderful job, who is started this initiative. And also I sincerely congratulate the entire body, president and secretary, for taking up this wonderful initiative where you are just logging into a day or two and getting a lot of information. The same thing in the form of many directives on a regular basis which are conducted, and some hands-on programs conducted in different parts of the country, whether in the institutional level or in the local organizational level, but you are all exposed to that. Many of the programs are conducted on free basis where if you are the member only, IACD member only, this facility is given. So maybe you are paying 7,000 8,000 rupees for the membership, but your journey is for the lifetime where you are getting the benefits from the association. If you are not the member, you are not getting any invitation for most of the programs. It's for the simple reason because every small family wants to grow and wants to be together and show the strength. So today, a small trade union having an association and union, and why not our specialty be strong enough to have a big voice, having say 5,000 to 6,000 members today. I think the actual number our secretary, Dr. Mohan Kumar, will say. So if we are on one voice, definitely our voice is going to be heard. Whenever the number is more in this country, you know that your voice is heard. Otherwise, you are a neglected child. Dear friends, you understand only association will come in your rescue of any issue in the individual level. So become the member and be a proud member or a privileged member of Indian Association of Conservative Dentistry and Endodontics. Of course, few of the events conducted in the association during my tenure as organizing chairman in Hyderabad, we have done a conference, and HRD Minister, Madam Purandareshwari, was the guest, and a few of the presidents and past presidents, you can see them in these illustrations. Of course, coming to the clinical registry, what is clinical registry? This is very, very important part of our Conservative Dentistry Endodontics IACDE, which is initiated this program. What is clinical registry? This is the eyes sees only what the mind is prepared to comprehend. Once Robertson Davis has said, that is, the eyes sees only what the mind is prepared to comprehend. That is, the clinical registry for variations in root canal anatomy offers a window to showcase these vagaries. Particularly, this clinical registry is whatever the postgraduate student does. If you feel that that is worth sharing with your association members or your colleagues of postgraduates, you can upload that particular case through your HOD or the faculty in the website, so that the case is studied thoroughly and scrutinized thoroughly, and that can be competing for the awards in the year. Second, once a case is submitted to the registry as per the stipulated guidelines, quality checks are performed for correctness and completeness of data by our team. If something is missing or outside the expected range of regular anatomy, it is processed for publication in the registry. So the registry is very, very helpful for all the postgraduates for documenting your case. And whenever you are doing a challenging case, please try to follow the guidelines and upload in the IACD website. That will definitely make a difference in your quality of working or for your future working. Then, of course, one of the unique programs which is initiated by IACD is a speaker bank. Dear friends, it is not an easy job. All the youngsters having extraordinary talent, particularly our faculty. They have come from different specialty, different colleges, different institutions with high quality expertise. So only the speaker bank, which is created by IACD, can help to impart their knowledge to all the postgraduates in the country. So the speaker bank has some guidelines. All of you should follow these guidelines, and you can send your resume or CV to the head office. If you are fitting into the guidelines, definitely you will be one of the speakers who can impart your knowledge to all the postgraduates. The best knowledge is the one you can share, recreate, and apply. With a constant yearning for the new challenges, continuing education, and skill enhancement, we bring to you our novel endeavor with the noblest of intentions. A lot of talent and potential lies amongst the conservative dentists and endodontists pan-India. This is a humble effort to bring out and portray the best before the world. Yes, I know you all have extraordinary talent. It's only possible when you're given an opportunity in the bigger platforms to excel. So IACD is providing that platform. We are thankful for the previous president and secretaries for creating such banks and encouraging the youngsters. The youngsters, you should be inspired. Many of the previous speakers, the current speakers are previous postgraduates. The current postgraduates also aim at to become one of the speaker, one of the part of the speaker bank speakers. The IACD welcomes all the members to be part of first ever Indian Conservative and Endodontic Speaker Bank. Of course, IACD Research Grant. IACD is having one of the noblest program, that is a research grant. Research, what does research mean? Research is to see what everybody else has seen and think what nobody has thought. This is Albert Gurdjieff has said that means many of us know what the content is, but many of us have not thought about it, how it could have been. So the researcher does that, and our platform provides to all the postgraduates to get into the research bank, because this is an encouragement given by the specialty when you become the member of Indian Association of Conservative Dentistry and Endodontics. How does it happen? IACD supports the research by providing grant up to 50,000 rupees to all the members whoever are interested in taking up the research project. Every year, 3 research grants are offered on a merit basis, 2 for the students and 1 for the faculty, according to the progress of the research and the topics submitted and approved according to the guidelines of Indian Association of Conservative Dentistry and Endodontics. Approval of the research proposal and the grant should be for the specific project, which should not be a dissertation study. All of you understand that your regular study which you perform in the department as a library dissertation or the main dissertation topic cannot be considered for the research grant. It should be in a different area, or it should make difference in your science. It should make difference in your working, where it has its own guidelines. When you go to the website of Conservative Dentistry, you can see how you can apply for the research grant. And according to the progress of your research, the 50,000 is granted in different phases. Of course, this slide is for, we have another innovative program, student exchange program, that is sharing the knowledge. Why this slide is kept in the student exchange program is, most of the postgraduates, you are seeing your own teachers on a regular basis, and your own seniors are the same faculty in the college. There are many things happening across the globe, across the country, and different institutions. One college may be good in regenerative endodontics, the other college may be good in micro-restorative endodontics, some colleges may be good in magnification. So when you go to that particular institution, what is happening in the other institution also you will be knowing. And also you're always bored 3-year program in the same institution. See that guy, why is standing upside down? Because always normal is boring. Even see that pretty woman, she always feels something different is better. So always I see the postgraduates to come out with your talent. When you go to the student exchange programs, you will also have some fun. By sharing your knowledge with the other postgraduates, also you see what is happening in the other institutions. So it is a normal program which is boring in the same college, doing the same routine work. This also brings the best out of you when you go to the student exchange programs. So please do not miss when IACD conducts a student exchange program in other institutions across the country. What is not happening here in my college, if my postgraduate is learning from some other institution, I will be the happiest teacher. So dear teachers, and we must encourage the student exchange program, and all the postgraduates must take the benefit of student exchange program. Benefit of student exchange program. First thing is making you more employable. When you have more skill apart from the routine, you are always required in, or you are always wanted in the other institutions. Second, making you even more globally aware. Globally, you are more aware about what is happening in the other parts of the country and other institutions and other departments. What is happening is you should be knowing it, and that is happening in our specialty. We are thankful to our specialty president, secretary, and executive committee for creating such innovative program, making you adaptable. So when you are in your environment, you are very comfortable in working. But when you go to the new environment, how comfortable you are, how adaptive you are to the new areas of working, that will only be seen when you go and work in the new area. So a new environment is always very good for all of us to have more comfort zone of working when you move out of your routine working. Take you out of your comfort zone and help you make global connections. Yes, you will be meeting new teachers, you will be meeting new postgraduates, and also you will be learning new skills when you go to the other institutions where they are stronger in other areas apart from what your institution is strong at. Of course, there are plenty of awards which are created by our Indian Association of Conservative Dentistry and Endodontics. These awards are to the faculty and the teachers and also the postgraduates. They all have various awards which are created. From 2016, recognize the talent and bring it to the limelight and motivates other members. How does it? These awards are in different categories, like IACD Lifetime Achievement Awards. Then IACD Outstanding Achievement Award, it is given to one individual. IACD Academic Excellence Award, IACD Clinical Excellence Award. The clinical cases, whatever are uploaded in the website, the best will be selected and they are being awarded in the conference of the national conference in a year. IACD Rising Star Award, an youngster who is having plenty of skill, when he submits his skill and talent or the cases, clinical cases, and the research if he submits to the specialty, then according to the merit, the jury selects and the Rising Star Award is given. Then IACD Humanitarian Award. So all these details are mentioned in the site, or you can contact the secretary to how to upload your details. And some of the awards we have achieved already, like Dr. Parameshwaran, Dr. Vimal Sikri, Dr. KDO, Dr. Subarao, many of them have got some lifetime achievement awards for their contribution to the specialty. Young Achievers Award. What is Young Achievers Award? Young Achievers Award can be in different categories. It is for the postgraduates, undergraduate awards, and IACD Dental Talent Award. This is exclusively for the PGs only. Many of the students, for their contribution for the specialty during their postgraduate course in the research format, they already, I think in the Kolkata conference, the Minister Babul Supriyo, in the presence of then the President Dr. Devendra Muzumdar, was given an Young Achiever Award to Dr. Nitya, and many of the IACD Young Achievers Awards, just few of them are being displayed here, because whatever slides are there I have presented, and this is these are some of the cases. The best cases which are performed in the website are uploaded in the IACD website, and they are being awarded. Case report of the month. Every month, the best case reports are uploaded, and the same are available for all the postgraduates to go through them, what techniques are followed, what materials are used, and what surgical procedures are followed, and also you can contact the particular author for the details. IACD welcomes the case from PG students, staff members, and practitioners to be posted in the website. After thorough analysis by a panel, if the case is good, it will be posted and communicated to that particular individual. That is posted in the website. The best 3 cases of the year will be awarded in the annual conference. So these are all done on the merit basis. The individuals, that is the reason I was mentioning in the initial part of my talk, documentation. From the day one you start documenting is very, very important. I know most of the postgraduates, you are very, very good in the young age in your photography, and any small new area when you go, you start taking selfies. Also let this your scientific area be part of your working, and try to reach these awards, and I wish all the postgraduates to work for them. And we have one of the most amazing journal of conservative dentistry. Lot of research is being promoted. Our Dr. Shishir Singh is doing a wonderful job as a journal editor, and Dr. Mohan Kumar is assisting him. And all of you from the day one start working for the publications. Publication is the only area which speaks about your quality of 3-year program. You have more number of publications, and any institution, when you complete MDS and go, the first question today is asked for any job opportunity is from which institution you have passed out, and how many publications you are having to your strength, and what are your additional strength in the clinical skills, and what are the awards you have received from any of these specialty organizations. Dear postgraduates, do not forget, do not neglect in publications. And the Journal of Conservative Dentistry is most reputed journal in the world, and it is PubMed indexed, and the details are available in the website. And we also have a newsletter which is having our face, that is the year-long activities are represented in the newsletter in the different formats. I think currently Dr. Mahima is taking care of the newsletter. It has a lot of content in this. IACD publishes newsletter titled Pins and Posts, kindly comprises happenings in the field of conservative dentistry and endodontics across the country. It includes not only the information of IACD events, but also panel discussions, scientific updates, and ask expert this expert section. That is, the columns are created and the replies are given by different experts. Pins and Posts also publishes the winners of papers, posters, presentations at conferences, conventions, and results of any other events conducted by IACDE. I want all of you to be, your illustration to be in one of these publications, one of the Pins and Posts issue before you leave your postgraduate course, because about your contribution to our specialty as well as your working to our specialty. I sincerely request all postgraduates to take active role in contributing to Pins and Posts. It also showcases the creative arts by IACD members and has IACD crossword, IACD jumble words. These are all the things to prove your talent. So just go through Pins and Posts and try to get involved in day-to-day contributions and working. Indian Association of Conservative Dentistry and Endodontics provides life membership to all those who hold postgraduate qualification in the specialty of conservative dentistry and endodontics, and associate membership to other specialties recognized by the Dental Council of India. Dear friends, all of you understand that becoming a member of Indian Association of Conservative Dentistry and Endodontics is a privilege. Do not get deprived of this, and we are not forcing anyone to join our specialty for the sake of membership. You are joining the specialty for elevating your status in this society, and also to become a proud member of Indian Association of Conservative Dentistry and Endodontics. It is one of the rarest privileges, and all the other specialty members can have the membership only for the academic activities. However, they do not have any part in the active role of our Indian Association of Conservative Dentistry in the decision-making guidelines. They are not going to have any say. It's only a member of Indian Association of Conservative Dentistry and Endodontics can be a decision-making man. And every member, whether the president or the ordinary member, has the same privilege. That is the unique feature of Indian Association of Conservative Dentistry and Endodontics. Once again, I sincerely thank all the postgraduates and the Secretary and President Dr. Mohan Kumar and Dr. Chandrasekhar and the Executive Committee members for giving me the opportunity to share my knowledge of IACDE. And I'm thankful to my family members, Prasanna, for cooperating whatever little contribution I am able to do. And all postgraduates, this quote just tells me that you should follow this. Notice good things in others as quickly as you notice mistakes. Forgive others as quickly as you expect from God to forgive you. So that makes your life or the smooth sailing of your journey in the specialty. Dear friends, once again, I thank all the postgraduates for joining this program. Wish you all the best in future endeavors and in your journey of life. Thank you very much once again. And I must thank my faculty, Dr. Shravan, who has helped me to do this presentation. Throughout, I have been troubling him. Dr. Shravan, I sincerely thank you for giving me the all the backup.
Thank you,
We
Karnaka
can
sir.
only see ahead, but we can see plenty there that needs to be done. So, dear friends, your journey is 3 years, but you need to do a lot. Keep that in mind and do not waste your time. Please sincerely thank Dr. Sanjay Tiwari sir once again for giving me the opportunity.
Thank you, Karnaka sir, for the excellent presentation and elaborating the activities of the IACD in so detail. I am very sure that all the students will become the member of the IACD and take the full advantages of the activities of the IACD. And there are many good things in the IACD which are for students, like you can avail the grants, you can become the member of the speakers member also. You can get the information about the other colleges also through the websites. The Young Achiever Awards, you can apply for that. So, but only thing is that for that you have to become a member. I'm sure that all of you become a member and take the full participate in the activities of the IACD and take the full advantage of the activities of the IACD. Thank you very much, sir. In case any questions are there, so thank you for the wonderful presentation. I again thank the IACD office bearers for organizing such a wonderful activity. And my request to all the students, there are many good programs ahead which are going to come in the today and tomorrow session. Please attend these programs. I'm very happy that right now also 460 students are there who are participating in the program. But please continue, because all these programs have been evolved for your benefit. Like many of the activities of what Dr. Karnakar sir has told, even I was not knowing that these grants we can apply for. That 50,000 grants are being given for research activities by IACD, which is a big thing. So depending upon the merit of the project, we can apply for that. You can apply for that, and they select it. So please do this thing to participate. And thank you very much, Dr. Shraddha and Dr. Karnakar sir, for this session. And with this, I present this your certificate of appreciation to, I think I present it or Dr. Shraddha will present. Dr. Shraddha will present.
Yes.
Dr. Shraddha. Sorry, Dr. Shraddha will present the certificate of appreciation. Thank you very much.
Thank you very much, Karunakar sir, for a very informative lecture. Thank you very much, Dr. Sanjay Tiwari sir.
Thank you.
Karunakar sir, you need to stop sharing your screen. Then only I'll be able to share my screen.
Yeah, madam, I'm just sharing. A second.
There will be stop share. There will be on your topmost.
Stop sharing.
Thank you, sir.
Oh, they will send the certificate, no?
Sir, you have to stop.
This is the certificate of appreciation for Dr. Sanjay Tiwari, sir. For a nice moderation.
Ma'am, are you able to share your screen? Ma'am, are you able to share your screen?
Yes, sir.
Yeah.
Okay. This is the certificate of appreciation. Please accept it, Dr. Karunakar, sir.
Thank you very much, ma'am.
And please accept this certificate, Dr. Tiwari, sir.
Thank you very much, madam. Thank you very much.
Thank you. Thank you so much. Now over to the next lecture.
Yeah.
So we will be going to the next lecture, but it was really well done, sir, Karnakar sir. And when I started my PG, I never knew that there were so many benefits. And like what Majumdar sir and all the stalwarts have put in a lot of effort to bring IACD to the extent what it is right now. It didn't just start there. It's grown and it's evolved because there were so many people who are putting their heart and soul through this. So I would request all the postgraduate students to be a part of IACDE so that we can grow together. So we will go ahead with the next lecture. The introducer, please take it up. Dr. Girish, you have to unmute yourself. Dr. Girish, please unmute yourself. Dr. Girish, you're able to hear me? Please unmute. Yeah. Yes, Dr. Girish, I think you should go.
Sir, am I audible now?
Yes, you're audible now. Please go ahead.
Thank you so much, sir. Good morning, everyone. It's my honor and great privilege to be part of this great event. Hereby, I am introducing our moderator, Madam Dr. Sonal V. Joshi. She is currently Professor, Dean Faculty of Dentistry at KLE Institute of Dental Sciences, Belgavi, Karnataka. She has graduated from GDC Mumbai. Post-graduation, she has done from KLE Institute of Dental Sciences, Belgavi. She has headed Department of Conservative Dentistry and Endodontics at KLE Institute of Dental Sciences, Belgavi, Karnataka. She is presently the Secretary, KLE Swashakti Empowerment for Women. She is also Academic Council member of KLE University. She is the Coordinator for Excellence in Aesthetic Dentistry, member of Editorial Review Board in Journal of Conservative Dentistry. She has numerous international and national publications on her name. She is the resource person at various national and international podium. She has been a keynote speaker at International Symposium on Tooth Whitening. It's evidence-based and clinical-based in Bangalore in the year 2017. She has guided a number of students for the research undertaken by them. And she has been honored with the Best Teacher Award for the year 2006 by the KLE University, Belgavi. And now I request our moderator, Madam Dr. Sonal V. Joshi, Madam, to introduce our speaker today, Dr. Vibha Hegde, Madam. Thank you so much. Over to you, Madam.
Dr. Girish, thank you so very much for such a kind introduction. And on the onset, let me congratulate the IACDE for having come up with such a brilliant program for our postgraduates. And I'm sure it's going to help them grow as good researchers, good students for the 3 upcoming years. With a lot of pleasure, I would like to introduce our speaker. And she happens to be my senior at college. She has done her post-graduation from the same institute that I have done. And Dr. Vibha is currently the president-elect of the Indian Association of Conservative Dentistry and Endodontics. Vibha, I welcome you with all my heart. Vibha is heading the Department of Conservative Dentistry and Endodontics in YMT Dental College and Hospital, Navi Mumbai, and with clinical span for over 25 years. She is a renowned educationist, especially in the field of endodontics. She has been recently awarded with a Distinguished Endodontist of the Year award by the Indian Health Professional in the year 2019. She holds a fellowship in Micro, Restorative and Endodontics awarded by the Indian Board of Micro, Restoratives and Endodontics. She has also cleared her first-year IBE program and also holds a diploma in the Society of Oral Laser Applications. Another feature that is a cap, which is a feather in her cap, is that she's been credited for hosting the 2nd West Zonal PG Convention Zone 1 and the 34th IACD National Endodontic Conference, which has gone on record and has set a benchmark. Vibha, has also been the secretary of the Maharashtra Association of Conservative Dentistry and Endodontics, MACE. She has a number of original research publications to her credit, both nationally as well as internationally in the specialty journal, and has been a keynote speaker at various national as well as international conferences. Vibha, I welcome you.
Thank you, Dr. Sonal, for the very generous introduction. And I'm truly proud here to be presenting and getting this platform on IACD, and especially a platform where I will be welcoming all the new postgraduates. And thank you, Dr. Girish, also. He is also there with us today in this session. And I begin with my presentation for today, and I welcome all the postgraduates of the first year. And I am sure that today we have even the other students also who are part of this session today. I know that. So I hope they make the best of it. It is not that it has to be only for the first years. So just give me a minute, please. Okay, so today the presentation is on the preclinical and the clinical curriculum, a journey of the students. So let me orient you to this preclinical curriculum. So you don't have to be great to start, but you have to start to be great. Not the greatest has been, so don't be afraid to take that first step. I'm going to provide you a brief overview on the preclinical practice, the preclinical curriculum, what are the goals, objectives, how it is different from the preclinical training which you have undergone during your undergrads and as a postgraduate, what are the core skill developments and what will be its applications. So preclinical exercises, they provide a comprehensive and accessible to basic operative skills and core clinical skills required to embark on a clinical dental training. So to sharpen the skills and to get the students accustomed to the clinical work so that the clinical chair side is minimized while working on the actual patient, and also to boost the confidence and gets the students ready to work on actually. Therefore, when you are trained into a preclinical program, you exhibit a lot of confidence when you are there working on your patients. You are very well versed with all the techniques, you are well versed with all the procedures, and you are very meticulous. And what we do in the preclinical training, as an undergrad, we would have taught you the ergonomics, the chair positions, about doing the different patient management areas like your retraction, your focusing, etc. But what is important when you work as a preclinical student in your undergrad and postgrad is that in post-graduation, the self-assessment and self-evaluation is what is more important. So I have always been telling my students that when you do a postgraduate, it should not be like the way you have had approached in your undergrad days. So what you need to do here is to need to be more critical about whatever procedures you're doing, the way you're doing. So again, read up and brush all the chapters that you have done in your undergrads. And when you start your postgraduates preclinical training, you must take more of the application based, what you would read again, because now is going to be more of a critical evaluation and precision of what you are going to do in your future. So the exercises that we generally have in your preclinical training is the carving of the tooth morphology in the wax, which forms the basics of how a tooth anatomy exists, what is the importance of morphology, the occlusion, and through this approach. So what are the core skill development and application is when we do all these exercises, we see a proper, establish proper contours, contacts. We have better and minute knowledge of all the details of the occlusal anatomy, like the pits, fissures, and the fossa. We learn to develop a correct crown root ratio of the tooth. We learn to exercise the application to apply all these knowledge and information into direct and indirect restorations, where we try to best simulate the occlusal anatomy in the restoration. And it also plays a vital role in the aesthetic dentistry, as that is one of the area where we need to restore, we need to recreate, and the natural look and appearance. So these particular exercises, when we do it, will help you to achieve better outcomes. The next exercise that we perform is on the plaster models. Now there is a controversy among many of us whether it should be done or not, but nevertheless I feel that it will help us to understand the nomenclature of the tooth preparation, the walls, the surfaces, to understand the basic principles of the tooth preparation, like including the outline, resistance, retention, and the convenience form. So this exercises signifies the macro version of the micro dentistry. Now we are into days of micro dentistry, so this would be something which is not really wanted, but yes, I say that it would give a better insight for a beginner in the operative field of operative dentistry. Then coming to the tooth preparation, which we do on the extracted teeth. Now these extracted teeth, they act as a natural surrogate for a live tooth in vivo. So when we do the different type of the tooth preparations, we get a feel of the tactile sensation on the human teeth. We can visualize, we can make a decision, we can take into account the texture, consistency, hardness of the enamel and the dentine, which is very important field for us as the endodontist. It helps us to differentiate between the enamel and dentine, the D junction, which are very significant anatomical landmarks, especially when we do our tooth preparation. Because not all the clinical situations that you are going to face are going to be the ideal situations, and you will be challenged by situations where you have to modify your tooth preparation, and that is where the role of the different tissues of the teeth and the knowledge about their about the properties of these natural existing tooth structures will come into play. And we do the tooth preparation on the typhoidal teeth. These are more or less the ideal tooth preparations that we do. Here we are focusing on learning the skills. That is, we learn more precision. It is possible for us to make ideal tooth preparations so that we get our principles right. And these principles can then later be applied in a in the patient's mouth, where you will find that most of the times are not really ideal conditions, but how it can be modified. So in order to achieve that level of application, what will be important here for us is to be able to know what is the normal, and then what is abnormal can always be modified and make the best use of application of all the principles in the future. Now, the core skill development here is this exercises focus on learning the ideal tooth preparation, cavity design, outline form, internal and point angles. It helps improve clinical skills and precision in the work. It aids in orienting to different quadrants of the oral cavity and understands simple things which a clinician should know is the instrument grasp, the finger rest while operating, and to help the operator get accustomed to indirect vision and transillumination while working on the maxillary teeth. And now with more of the magnification that is in picture, we all need to be knowing all the ergonomics very well. The next exercise that are done are the access cavity preparation, cleaning and shaping obturation. Now these access cavity, which we generally focus on the extracted teeth, they give you an idea about the outline forms, the angulations that need to be used during your access cavity preparation, the different type of the armamentarium that needs to be used, and access opening of the different types of the teeth, that is your anterior teeth as well as the posterior teeth, to explore the number and location of the canal orifices, to be able to manage the curved canal and calcifications in the canals prior to your clinical work. Now, these type of exercises are also those which we do in your internship. Now, why it is important as a postgraduate is because in postgraduate, you will be learning not only the basic endodontics, but you are going to be faced with much more challenges like the she-shaped canals. You will be faced with calcifications. You will face a lot of aberrations in the canal. And these kind of variations, deviations, and abnormalities are something which we all need to be well versed with, and it is definitely going to be a challenge when we are going to do. Therefore, these preclinical exercises on extracted teeth can help take you far away to get an insight into these areas of the difficult parts or difficult areas. So when we do the cross sections of the teeth, now that is another exercise which you have been doing. That is, we want to study the histopathological features of the hard tissues of the teeth. Mostly the enamel, dentine, the pulp space are very important. So this tooth sectioning is important, especially in the field of forensic odontology. But for us as endodontics, it helps us to give an idea of the canal, the curvature, as you can see in all the diagrams here, how the disease affects the pulpal tissue, what is the significance of the remaining dentin thickness, especially when we initiate the cleaning and the shaping procedures, what are the challenges we are going to be facing, which is the amount of the tooth structure that is going to be removed, and how can that be prevented. So these are all insights that you get when you look into all these cross sections. So we get to visualize the three-dimensional view of the sections of the pulp space, enamel, and dentine, understanding all the anatomy of the root canal, any curvature on the variation in the canal configuration, or what will be the core skill development doing this exercises. So after having done this over a period of 6 months, I think most of the institutions, they propagate all these exercises, which is to be carried over a period of 4 to 6 months. And before all these are, and after all these exercises are done, next we feel that the student is now ready to take over to his clinical work. So you have the passion, you take the action, and then you see the magic will happen. So for the action to happen, you have to invest in your passion. You have to be one of the best clinician. There has to be a difference when you are an undergrad doctor and when you are a postgrad doctor. Because today, if you look at all around you, you would have experienced that as good as you are, we also have today even our undergrad doctor who are equally competitive. Then what is going to be the difference between you and an undergrad doctor? Well, I think the core clinical skills, the findings of all the work that you are going to be doing, your expertise, which you are going to carry over a period of 3 years, that is going to be very important. And most of all, the knowledge that you are going to have is something which will set you apart and set a standard and edge for you over the other juniors. So the goals and objectives of clinical, what are the ideal protocols that one need to be followed for a successful and long-lasting treatment? What is the stepwise guide that in a postgraduate curriculum and the guidelines that are to be followed in clinics considering the current pandemic? So in practice, the specialty is always backed effectively and efficiently by scientific knowledge and skill. As I said, this is what is going to set you apart. Every day we are having seminars, we are having the journal club presentations, we do a lot of the case reports, we do a lot of the case discussion and presentations. And why are we doing all these exercises? That is because it helps you to use not only the backup of your knowledge, but to translate it into proper treatment planning so that the treatment delivered will set you apart. So there are a few ethics which all of us need to follow once when you come into clinical practice. Ethics is knowing the difference between what you have the right to do and what is the right thing to do. You always ought to be an active listener, and you should be very curious about all that you do, every step that you do, how you do it. These are very and critical about almost everything into your clinical practice. So the Code of Ethics of American Dental Association states patient's autonomy, that is very important. The non-maleficence, the beneficence, that is no malpractice, benefit to the patient. You should be fair to the patient and veracity is the patient should be given assurance in whatever the approach you as a clinician are contributing towards the patient. So continue to evince keen interest in professional education in this specialty. These are the various platforms, as Karunakar sir in his presentation has very well highlighted all the association activities which are done solely for the purpose of uh, imparting the professional education to all the specialists. So we are organizing conferences. These are the various platforms you would have all come across, and these have been great platforms where all of you would have gathered a lot of knowledge, a lot of experience, clinical expertise that has been delivered. And you learn so much that there is no stop to learning. Even at this age, we continue to be learning, and it is a continuous process, friends. You never cease to learn. Stay always curious, keep learning and growing, and always strive to be more interested than interesting. Then how are we going to achieve all these things? Well, you have to be able to differentiate between the signs and symptoms which are caused by the pulpal or periapical pathosis and those which are formed by other orofacial pathosis. So that differentiation has to be the first basic objective which you should be able to achieve. So when you have a pulpal and a periapical pathosis, the student should be able to identify, should be able to find out the cause, and should be able to chalk out a appropriate treatment plan and estimate the prognosis of that particular case. One should be able to complete all the clinical acceptable to all the treatment procedures to a clinically acceptable level, and the experience at that point will be very important, and there needs to be consistency also in all the approaches that you are going to render in your clinical practice. You have to be able to identify and distinguish between those cases which are within his or her ability to manage effectively and those which should be referred to other specialized practitioners. So you need to be in a position to identify that. Many a times you will come across clinical situations where you are not in a position to give the entire treatment outcome. So at that time, one should be able to identify that you are going to require an interdisciplinary approach, or you need the intervention of the other specialties as well to carry out the procedures. The one should be able to accurately and critically complete all the clinical procedures, but there must be a good backup of all the techniques you should all be aware before you pick up the cases. So the best thing a dentist can do is to do the right thing extremely well in the first time so that it lasts for a long time. None of us would like our patients to come back to us again and again with a complaint after you have done treatment, isn't it? So if you don't want to be in such an awkward situation, then try to make a more the best that you can do in the first visit itself, right from the diagnosis to treatment planning to the prognosis identification and the procedures that you are going to do. So what are those clinically apt procedures or the long lasting procedures that we can perform as doctors, and how can we do that? Well, the most important part will be to elicit a detailed case history, to come to a provisional diagnosis, to make a proper definite diagnosis using all the different aids that are available to us today, to do a meticulous documentation. It has been spoken of again and again how important documentation today is in today's modern dentistry globally as well, and it should be the standard of practice where documentation plays a very important role. The treatment planning is another important phase where you are going to be very methodical, where you are going to elicit a lot of information, where you will be giving the assurance and confidence to the patients as to the prognosis that he can expect and as to the results of your treatment procedure, and regular follow-up, which is again the most important part. There can be nothing more gratifying than to see the outcome of all the treatment that you have done during your clinical work. Now, significance of the case history. I am not going to go much into all these. You have been taught in all your lectures and in your seminars. You will be doing it as well. But just to provide you a brief overview is you must know that it is related to the diagnosis. You have to take sometimes precautionary measures, pre-medication, medical consultations, And as we know that even the dental treatments might affect the patient's systemic health, and one should be very well versed and elicit a proper history, use the various diagnostic methods and tools that are available to us, the subjective symptoms, the objective symptoms. You have all been learning since your undergrad days the importance of all these methods, that is hypersensitivity, and how you check the hypersensitivity, the pain, visual, tactile, percussion. You use the objective symptom evaluation by using your radiographs, by the white wings, OPGs, and the pulp sensibility testing which you are doing, as well as the CBCT that is become the gold standard nowadays in today's endodontic practice for diagnosis. And it demonstrates an anatomic features in a 3D, that is the intraocular, panoramic and cephalometric images cannot do that. So that kind of information can be elicited by doing the CBCT diagnosis. So these units, they reconstruct the projection data and they provide the interrelational images in 3 octagonal planes: axial, sagittal and coronal. Now for example, you can see these lesions here, which is shown in 3 different planes. You can see the reconstruction, and it gives an insight into all the buccal, lingual, cortical plates, any missed canals, any fracture lines, etc. So these are the biggest advantages that the CBCT today had. And yes, it has to be used very judiciously. There are a lot of guidelines as to the use of the CBCT. So just don't be very generous in prescribing every patient to undergo this diagnostic method. So follow the guidelines, and a proper prescription of the required area should be advised to the patients whenever we are trying to use these diagnostic methods. Documentation is again divided into examination, diagnosis, treatment planning, progress and monitoring, and treatment outcomes. As you all go through in your first year, we all do a photography course. Apart from the diagnosis and the history eliciting, which we do on the chair side, we should also use a lot of photographic records also for the documentation. Then it is very important for you to have all these baseline records. So as you go ahead into the over a period of time, you can be able to identify the healing process, the results and the outcome of whatever you are doing today. Therefore, try to have it right at your chair side. And you can also get an idea of all the procedures that you are doing, how successful it has been over a period of time. So that becomes very important. And a detailed lecture will soon be following regarding these things. Here is an example which I would like to give you. You see a lot of preoperative images, which is ideal for, you can see the periodontal condition of the teeth, the gum condition. You can see the facial profiles. What you also observe is the tooth wearing, the periodontal pocketing. And when you do your treatment planning, what you need to ascertain is the inflame-free gingival margins. Around the defective margins, they should be, they are removed and the area is being treated. And after temporization, you will see the healing, and then you can proceed with your procedures. Similarly, here you can see the poor periodontal health, which after routine cleaning, scaling, etc., you can see that the tissues have healed well. So it helps you to evaluate. Therefore, the baseline recordings become very important. Similarly, here are some cases where you will see the healing of the tissues which has taken over. Here you will see the periapical lesions, and maybe you have 2 canals of your lower incisors, and angle view showing the entire canal system, and a follow-up which is showing the healing of the periapical area. Similarly, here are the molar teeth where you see the periapical lesions, and after they have been endodontically treated, have exhibited the healing of the lesions. So also is another case here of the premolar, which you see of the canine premolar area, which is showing a huge lesion and which has healed over a period of time. So this kind of evaluation, it is nothing but the treatment outcome, where many times you are in a clinical dilemma, whether we should just be doing a conventional endodontic treatment or a surgical approach. So often we find that our postgraduates come to us showing a lot of their cases, and they are very happy and thrilled about it. So why are they happy? They are happy that such a large lesion which they have attempted non-surgically has healed and there is no requirement of surgery. So you can imagine the amount of the satisfaction that you can have. You get to see your own work. You get to feel confident about the approach that you have chosen. You get to feel the confidence that the patient has in you. And every patient, believe me, will be the most happiest person if they are told that they don't need to undergo a surgical procedure, especially in a situation like this. And that can be a big prize that that can be given to the clinicians. So these type of gratifications, when you do your when you make your own treatment plans and you see the results, is something which all of us will treasure in our lifetime. And these are nothing but the experiences which will carry you a long way. So there are different phases of the treatment planning. That is, we have your diagnosis where the dental and medical history are very important. We do the clinical examination and take the radiographic documentation is carried up. And many a times when we do the aesthetic cases, rehabilitation cases, or severe occlusal deformation cases, we see that the wax up and aesthetic evaluation become very important. In the phase 2, what we see is there is the we seek the basic periodontal intervention where routine prophylaxis will be important, or if there is anything required that should be done at the stage itself. Then we have the endodontic therapy that should be initiated, removal of all the existing restorations and the caries control. In the phase 3, what we do is the crown lengthening, we do the balanced occlusion, we do long-term provisional restorations, make the patient comfortable before we proceed to the permanent restoration. And the maintenance phase is as important. Recall after every 6 months of any treatment procedure, and even as a routine measure, is very, very important. All the anti-caries applications we can have in the form of the fluoride supplements. You can reinforce the oral hygiene to the patient as well as improve the dietary habits, which will be beneficial in the long run. And believe me, all these things, a simple thing like maintenance phase, follow-up phase, and when you give the instruction, what I have seen in my practice is that patients feel very happy and they feel the concern of the doctors who are giving them the advice to do to maintain oral hygiene and showing them brushing techniques. So that inculcates a lot of confidence, and there is some sense of the patient looks up to you, and and he will cooperate in a much better way. So you are able to achieve the compliance of the patient. So all these things can be very, very important. And follow up, consistent follow up of all the lesions, of all the treatment that you have done is very important. It is not only endodontics, but even in all your aesthetic cases, in the simple restorations that you have done. Many a times you will find your patients coming and telling you, doctor, you have done this filling for me 10-15 years back, but nothing has happened. It is all fine. So don't you feel nice to hear all these comments from your patient? Yes, you don't want your patient to come back and saying that, okay, you did a filling and now it is giving you trouble. You don't like to listen that, right? You are always happy to hear when a patient gives you comments like, where he is kind of honoring the work that you have done. So these are a few of the things that you get from the patient. The next thing is when you come to your clinics, what are other important things? The scrubs, they are offer an established standard of dress code for those working in the dental office. One of the biggest perks the scrubs offer is that of the comfort. A comfortable pair of scrubs gives you the appearance of a professionalism. It helps you to maintain the asepsis. They can be easily autoclaved, and it is a much better way to function in clinics. And dental offices have a code and standard of safety they must follow, and uniforms are a part of this standard. So I would advocate to have this dress code when you come to your clinics. And it is just not enough to be only maintaining all these things. What is also more important is to maintain a clinical decorum and appropriate demeanor. So the basic training, what you do as a first year PG, you concentrate on your pre-clinics. You have your biostatistics, you undergo your research methodology, your photographic workshop, and you are maybe also engaged in some institutional activity where you are taking some very basic lecture, and you are busy in your thesis synopsis within the first 6 months. So this is what you do in your first year. And then when you continue into the clinics, again, you start with the very, you know that in your first year, you have to also be appearing a basic science exam of the university, which is 100 marks, and you have to clear this examination. And then when you come to the clinics, parallelly, the basic restorative procedures and single endodontic cases using hand files is important. So we begin with doing your single rooted teeth and maybe your premolars. We're doing your hand files. Now, why we are emphasizing doing your hand files here is that you get a hang of the tactile sensation. As you know that it is tactile sensation is one of the most important uh, uh, method for us as endodontists to understand the root canal. It says everything about the root canal. We get all the insight and the information of the root canal just by that tactile sense. So it is very, very important for us to hone that basic skill of the tactile feeling. And therefore, I think to do the first exercises with your hand files, etc., is not a bad idea. And in fact, it is most of the youngsters today, we are all looking at going fast with doing all the rotary endodontics. And there are many of the articles and many of the speakers are also saying that there is no need to use your hand files and you can directly use your rotary files. No, I wouldn't agree much to this, but I feel the basic skills of your tactile sensation is still very important till date, and that cannot be overlooked. So all these type of exercises should be done in your first year. Then as you continue and your clinical skills in the second year, now what is it that you're going to do differently in your second year? Now second year for you is the time where you are also challenged when in submission of your library dissertation, maybe in the form of a systemic review, etc. You are doing your journal clubs, you're doing your case presentation, seminar, etc. All these activities are happening. But on the clinics, what you are doing at a second year level is you are now you have to focus on selecting the cases, because your the choice of cases will play a very important role, where you will choose moderately challenging operative and endodontic cases, including management of deep carious lesions and variations in the root canal anatomy. So you have to explore your forte of all the work that you are expected to do. In second year's PG, you have the scope to select your different cases, like canal anatomy variations. You have your MB2, you have your DB2, you have your mid-mesial canals, you have your C-shaped canals, you have your curvature, your curved root canals. And all these kind of variations are the different type of case selections that one should do. And you must make it a point to take opportunity to do the OPD, which is very important, because that is the place where you will get all these cases of your choice. So try and build up your profile and try and build up your forte, where you will do a case selection for you to master your skills slowly. And it is not only important for you to only select the case, but by second year, you should be in a position to increase your speed and efficiency as well. So the cases which you are doing in your first year and when you're doing in your second year, there has to be a difference, where the speeds will be increased, the number of cases will be more, the case selections will be more, the forte that you're choosing will be more. And here also what you need to understand, very important in your second year, is the maximum amount of clinical work and the scope which you have will be in your second year, and maybe in the beginning of your third year clinics. So try to do maximum work in this period, and you have to invest totally into clinical work this very important period. And the cases that you will start now, maybe the special type of cases that you are looking into, you will be able to get a follow-up also of those cases, and that is the most important thing. So third year, you continue to maintain your clinical demeanor. By now, you are becoming mature and you will be more confident now. And here, the type of cases is you must look into surgical management of cases, look into extreme management of complex and clinically challenging cases. You have all your fractured retreatment type of cases. These are very challenging, and interdisciplinary approaches. So some cases should be selected where you are requiring the intervention of other specialties as well. So all this will help you to integrate and compile into a good treatment plan, and that is how you can approach in your clinical practice. And yes, you are parallelly challenged with your final dissertation submission in your third year. And not only that, you will be appearing your final year exam. So you can say that practically, under most of the health universities, ours is the MUHS, and so most of them will be challenged by completing all your work, your studies, your results, etc., for your dissertation. And at the same time, there will be a lot of mock tests which are conducted by many institutes, where you are having the faculty from the adjoining institutions coming and examining you as well. So that helps you to boost up your confidence. And it is always good that other than your own teachers, if you have other teachers also come and conduct a mock exam for you, that will make you more confident. So these are a few things that will happen in your third year. And also in your third year, what you will experience is that uh, you will be most of the time into exam oriented cases. You will be doing the case selections, you will be doing the preparatory cases for your exams. And what is important during your exams, the case selections have to be done much priorly, because there is a phase where you are doing a preparatory of the exam oriented cases. Therefore, the case selections, if you want to give a good clinical exam, if you invest in doing a good case selection, you have to invest good time, because you have to prepare. Suppose if they are periodontally challenged, you need to get all the periodontal interventions or some other kind of orthodontic interventions or anything, or prosthetic interventions which are required prior to you choosing that case. It just should not be focused on treating one tooth, but it has to be an overall. So such type of case preparation and case selections for your final exams will definitely fetch a good impression of you on the examiner. So one must focus on all these points in your third year. Now coming to the new normal, as we all know, we are in the facing this pandemic. So yes, we have heard lot of lectures. I think we can all write a thesis on the COVID-19. So I shall not go into much details, but we as dentists are challenged by the aerosols, and which are in, as we are working in very close proximity to the patient's oropharyngeal region, and we can potentially be exposed to the cross contamination from these patients. And so we have to identify a possible, we should be in a position to identify a patient with a COVID-19 infection, and be not hesitate to refer these patients with a confirmed history or showing signs, symptoms to appropriate treatment centers. So in a world full of problems, be the solution. And we as doctors have the power, the privilege, the knowledge, and the empathy to be one. How do we proceed continuing the dental practice? You have to treat every patient in your practice as an asymptomatic carrier. These are the basic things like the triaging and trying to identify. You have to make a proper questionnaire where you try to know the presence of any febrile respiratory illness. Elective dental care should be deferred for at least 2 weeks to the patients. So this is what your approach can be. You can render the elective care, urgent care, and the emergency care. So you can defer 2 weeks. That will help you to closely follow up the patient if he is appropriate to be taken for you for your dental intervention. Urgent care can be pharmacological management and close follow-up, and emergency care in negative pressure room, airborne isolation rooms, etc. So this is a very standard COVID-19 screening questionnaire. You will all find it almost everywhere that you go around. You have to fill this questionnaire. So also in all the hospitals, identify and assess the level of the emergency. The waiting areas have to be prepared. A proper triaging area is followed everywhere. And the protocol of the dental operatory, where you have to be, asepsis plays a very important role for us. So pre-procedural rinse, sanitization, rubber dam application should be done prior to establishing any treatment procedures. Extraoral imaging as far as possible is okay to use, and do not initiate cough during taking your IOPAs. Heavy volume suctions are important, and aerosol generating procedures can be limited to any emergencies as required. And the operatory should be well circulated. And of course, most of the university institutes have already put us through this rigorous training of the doffing protocols that should be carried out in your operatories. So most of us have undergone that training and should follow. So first, the surgical gowns or the PPE kits that we are using, the gloves, the mask, the doffing protocols should be followed as per the guidelines. And natural ventilation in all the operatories is very, very important. Air must be drawn into the room from outside, and all the contaminated uh, the airflow must flow from the less contaminated zone towards the more contaminated zone. And the HEPA filters, etc., can be used. We have the defogging units, etc. So I'm not going into too much details of this particular things. We have had a lot of lectures on this, but we have to understand that these are very important things, and this is going to be a standard of practice in the future to come. The donning and doffing areas need to be critically identified and maintained, like all your gowns and your gloves, your masks, etc. And hand hygiene performance is very, very important, especially with the soap. So in this unprecedented challenges necessitate the unprecedented solutions. As dental healthcare providers, our primary goal is to serve our patients during their times of need. However, the current pandemic makes dentistry a very potent channel of community transmission of disease. Friends, please let me tell you, the attitude which most of us have, chalta hai attitude, should not be encouraged at all. It is nahi chalta hai. So please, this is a time for us. It's an eye opener. This pandemic, has much as the challenges that it has brought, it has also brought in a lot of positivity. Let us look at it more positively, where it has taught us that sepsis cannot be neglected. And so no chalta hai attitude, and let us all look into our clinical practice, because that is what is going to be our future. So you recognize all the dental settings which have unique characteristics that warrant space, infection, and control considerations. You prioritize the most critical dental services and provide care in a way that minimizes the harm to the patients from delaying care, and harm to personnel and the patients from potential exposure to SARS-CoV-2 infection. Minimize the procedures if not an emergency, and proactively communicate to both the personnel and patients the need for them to stay at home if sick. So do not hesitate to make these important decisions. Make that change within yourselves, and try to be the clinicians who are more responsible. This is one of the best statement which I really like, and it's very close to my heart, put forth by Gandhiji, which says, the best way to find yourself is to lose yourself in the service of others. So with this, I thank you one and all for your patient hearing. And thank you very much. I hope this will take you a long journey through your clinics. And once again, all the best wishes. I thank the head office, IACD, for having conducted this wonderful program successfully in the benefit of the students and all the faculty. And thank you for giving me an opportunity to be a part of the same. Thank you so much.
Thank you, Vibha. It was a very extensive and a very informative lecture. And I also feel very much that the desire for the students to move from the preclinicals and rush to the clinicals is absolutely rampant, and it is there in every institute. With your lecture that you have delivered, I'm sure they have realized the importance of how to conduct themselves in the preclinicals. What is it that they need to learn from the preclinicals, and the different SOPs that they have to follow in the clinics, not only in normal times and these most unprecedented times. So Dr. Vibha, thank you very much for educating us on how to excel in the clinics as well as in the preclinics. Thank you. I would also like to thank the IACD for having given me a chance to moderate this session. Thank you so much.
Dr. Girish, you have to unmute yourself. Dr. Girish? You have to unmute. Dr. Girish? Are you able to hear me, Dr. Girish? We are not able to hear you. I thank both Sonal ma'am and Vibha ma'am for conducting this lecture really, really well. And like Vibha ma'am said, rushing from clinical to preclinical is very fast. I mean, preclinical to clinical is really, really fast. What the students should really understand is how important preclinical is to enter into a clinical stage. We're happy to present the certificates to Sonal ma'am and to Vibha ma'am. Thank you.
Thank you so much.
Sure, ma'am. I think Girish is having some issues with connectivity.
Yeah. Thank you, everybody. Thank you.
So we will be going on with the next lecture. I would like to ask the introducer to proceed with the next lecture. Dr. Girish, you should, I think you should stop sharing the screen. Dr. Girish, screen share. Dr. Girish. Yeah. The next introducer can please take over. Yeah, no. The next.
Dr. Mohan, I don't think he's there.
Or shall I continue? Shall I start introducing Dr. Mamta?
No, I think someone should introduce you.
Yes, sir. Just give me a minute, sir. I'm introducing you.
Dr. Bharanwal is there, so he has to be enabled. He's in the chat. He said he has to be enabled.
Just give me a minute, sir. Good afternoon. I will be introducing Dr. Konapa. I think Dr. Baranwal has some issues. Dr. Konapa obtained his bachelor's degree with first class from A.B. Shetty Memorial Institute of Dental Sciences, Mangalore in July 1994. Passed first and second VDS with distinction, third and fourth with first class. Obtained Master's Dental Surgery from SDM College of Dental Sciences, Dharwad in February 1998. Obtained Diploma in Hospital Management from Chennai. Secured Best Paper Award on Composite Inlays Indirect Technique in December 1995 during the 7th National Conference of Indian Society for Dental Research. Successfully guided 16 batch of postgraduates, has various presentations and lectures to his credit, both national and international. He is a member, executive member of Federation of Operative Dentistry of India, executive council member, life member, and founding member of International Dental Education Association, that is called as IDEA. He's been an examiner and a paper setter for various universities, sports, especially won prizes in hockey and TT tournaments. We are happy to have you, sir.
Thank you for the generous words, Dr. Mohan. At the outset, thank you for the opportunity given, and it's good to see the great initiative taken by IACD. Very few associations have taken such kind of initiatives. In spite of the pandemic, we are really working well. It's really good to see that all our fellow members are putting a lot of efforts. And I take this opportunity to introduce Dr. Mamta Kaushik, who's working as a head of department at Army College of Dental Sciences at Secunderabad. She has obtained a BDS as well as MDS from Government Dental College and Hospital, Ahmedabad, in the year 2002. She has 18 years of teaching experience as a clinician as well as PG and UG teaching. She's also a development leader and an administrator. She's been a keen academician with numerous national and international publications and peer reviewer for 5 prestigious journals. This speaks volumes about the kind of research work she's been doing. And she's also the editor of Journal of Army College of Dental Sciences, an academic editor of the British Journal of Medicine and Medical Research, and the founder editor of IACD newsletter, that Pins and Posts. That's when I first actually got in touch with Dr. Mamta. I saw the kind of efforts they put in. She and her team did a lot of good work with Pins and Posts. And she's been the administrator for the National Clinical Register for Root Canal Anatomy. And finally, to top it, she's the recipient of the IACD Award for Academic Excellence in the year 2018. So I'm sure with her kind of experience and academic brilliance, the first years will have a good learning curve during this program. Welcome, Dr. Mamta.
Thank you, sir. Thank you so much. It's actually really nice to be introduced by you. I really look upon to all senior people in our fraternity. Thank you so much. So my topic today is documentation, the key to success. At the onset, I would like to thank IACD for letting me work here. Congratulate all of you, all the postgraduates who are going to specialize in conservative dentistry and endodontics. I think you all are winners already because you have chosen fantastically. You couldn't have picked up a better branch to do post-graduation in. And I wish all my teachers, and I hope that you all wish all your teachers a very happy Guru Purnima. All the senior people here who are there in the panel, all the people who are not there in the panel, and everybody who's contributed to shaping me to wherever I am. The most commonly used phrase in 2020, we are standing on this platform today, is, can you hear me? And I really hope that all of you can hear me. It's really difficult to connect to people on the virtual world, but if it was not for this, I don't think we would have been connecting with all of you all over the country. To start with documentation, I had mentioned this in my first newsletter also, that if a tree falls in a forest and there is no one around to hear it, did it make sound? And the answer here is no, because sound is actually the sensation excited in the ear when air or other mediums come into motion. So if there is no one to hear you, you actually haven't made sound. It starts with that. It's actually a big motivation for publications. When you've done work, people should be able to hear you. And how do you move ahead in your life if you do not have any recording? So documentation, I think, basically is the key to success here everywhere. I'll be splitting my presentation into two parts. First is your academic part, because that's your short-term goal. Your short-term goal is to finish your 3 years and successfully. And your long-term goal is to, get more success in your life, which will come with your clinical records, which you make a habit of recording now, which goes a long way in your entire life. I passed out from Government Dental College, and we had a fantastic setup, lovely teachers, and a great deal of cases that were coming through. However, we were casual with recording. I would not say that, and we had lenient teachers who were not actually scolding us so much and were letting us work, and not really pushing us to the corner for not recording too well. Then too, we had a lot of cases. So I really think recording is very, very important. We start with the academic records. This I will go through very, very quickly, because we all know we have to have a pre-clinical, which you have to finish. Then you have to have your clinical records. In the pre-clinical record, this is how we maintain it in our department. So we have a preclinical record where the data is given by the DCI. The Dental Council also requires us to complete it in 4 months. However, each institute has their own regulations. Some people continue doing the preclinical along with clinics. Some people complete it and then enter the clinics. If we work meticulously from the beginning, we should be able to complete it at time, totally in time. So that's the preclinical quota. Vibha madam has spoken about it. And you get graded for your preclinical quota according to your performance over there. After the preclinical quota, we also need to record our academic activities, because we do a lot of academic activities. Dental Council calls it as A1 and A2. So academic activities is everything that you attended and all the presentations that you made. So every seminar that you attend of your colleagues, your seniors, and all the PGs, every conference that you go to, every journal club that you attend also should be recorded in your logbook. At the same time, obviously, every presentation that you have made has to be recorded in the logbook and has to be verified and ratified by your guide or your head of department. Because unless these are verified, I claim that I have done XYZ. Who is there to verify? Your academic activities and records will verify that. Okay, that's the quota given by Dental Council, mandatory. You can have more. Most of the times, most of us have a fewer, because it gets difficult to meet the required quota. However, we push ourselves to meet this requirement, and I think it's very reasonable to expect this much. 4 clinical cases in a year and 5 journal clubs, 5 seminars in a year. Overall, you should also have 4 papers and posters in the period of your 3 years. So conference attendance and presentation of your papers and posters there plays a very vital role. And whatever you take to your conference will again depend on how well you recorded it. So finally, everything comes down to recording. Then, of course, there's a clinical record book. So there is a postgraduate clinical record book where you have to write every case that you work on, okay, and they have to be categorized also. These are requirements of the Dental Council. These are not requirements which I am, presenting like this. These are there in our curriculum. These have to be followed by us. They have been thought over and they have been presented. And this is what we follow in our institute without any moderation to it. Your colleges can up it, they can better it, but they cannot avoid it. So all this has to be recorded. There is also a quota of clinical cases. So this is additional. These are the minimum requirement of cases which you have to complete every year. That's a minimal. We always meet more. In certain cases, I agree that it may be a little difficult for you to meet, more than 5 or more than 10 bleaching cases in a year. However, 10 have to be met with. So from the beginning, I will go back to the first year quota. So root canal treatment, you will definitely do more than 20. You will do anterior, you'll probably do posterior also. But certain type of treatments like your bleachings and your ceramic jacket crowns, inlays, direct, indirect and all. So you have to aim for it and meet them in your first year. If you meet them in your first year, automatically you will meet your second year quota and your third year quota also. So these are the minimal requirements. They are not the maximum. And they also have to be recorded in some places so that you know that these are done. Now, when you do your seminars, your journal clubs, and your hesitations, you also have a checklist. These have to be evaluated and assessed by your teachers, and they have to be assessed by all your teachers. So the checklists are again given in the Dental Council regulations. What we do in I'm running through this very quickly because I have a video here. This is how we file it in our department. So we make a box file, okay, and that has a checklist of all the 7 checklists are filed there. We separate them with separators. This is going to go slightly slow, however. So we separate them with file separators so that all the checklists are there. Some of my students take it to another level. So they put a monthly checklist and they've done 36 Xerox of the page and put this. There is no way of digitalizing this, but 36 is not done for JCs and seminars. JCs and seminars, you can have 15 each because that's a minimum requirement. And when it comes to evaluation of your thesis and your seminars, you need to go forward because these gradings and marks again are tabulated at the end of your 3 years. So clinical OPD is a monthly evaluation. This starts right after you finish your preclinical work. So like this, we have filed all the checklist. We grade all of them. There is a checklist for your thesis presentation also. Clinical case presentation, of course. These are 4 in a year. So you need 12 of these. But I would really suggest that you make a box file this, put the page separators so that you don't miss out on it. And this will not be just one person. These are my signatures here because I was the evaluator. Wherever the other faculty is evaluating, their signatures come verified further by me. So this is my PG who's passed, or we picked up his checklist because it was complete there. So I will move on to the next slide now. At the end of 3 years, this is how each trainee is evaluated. So you have a faculty member and you have their mean score of all the checklists done together. Then you have that aim of 3 years. You have joined today, you're already thinking of when you finish. End of 3 years, again, you make a preclinical record. So you're all aiming towards this. Okay, this is your verification of 3 years. I will pause here. Okay, everything is documented in this file. We do the case records as well as all your publications, posters, thesis synopsis, all the workshops, seminars, journal club presentations, participations, everything in this. Some people put their case records separately and their academic records separately. Perfectly acceptable. Absolutely nothing wrong in it. But my institute follows it this way. It's perfectly up to your department, your college, depending on how they want to follow it. Only thing is, this is an entire synopsis of what you have done in your last 3 years. And special cases also, we put in here and we put the case records there. Okay. Again, I will come back because I will go now to the clinical part of case documentation. And I hope I don't get an answer like this. So can you hear me further on the virtual platform? Please do not say not. Because I really hope that you start registering your records now. Now we come to our clinical case records. Okay. Vibha madam did mention briefly about this, about case history, radiographs and photographs. So case history, every department, we have a separate case history sheet for endo and we have a separate case history sheet for conservative procedures. You need to have a case history. You can do this digitalized also. You can have it either on paper or have it digitalized. I would prefer if we could digitalize this because having it on paper will be too much of paper in your hand. Okay, radiographs also, certain institutes still follow conventional IOPA films. So you can take them and file them in sheets You can insert into sheets and keep it like that. Or you can print a RVG together if your institute is wanting you to have printed record of everything. Alternately, you have to have it, sorry, there is a video here also, into a RVG. So initially what my students used to do is they used to have everything in the RVG, but I made them segregate into folders. Each student has their own folder and they have all the RVGs of that particular patient put in that folder. So that way there is no mix up of somebody taking your cases and you don't have to search too much. The next very important part is photography. There's a little investment which comes into this. There is equipment. There's of course camera, intraoral mirrors, streaks, retractors, contrasters, likewise, and so on and so forth. But every institute, the Dental Council requires to have a DSLR camera. Your institutes may not be willing to give it to you because as soon as they give it to you, they expect that you will spoil it and give it back to them. So some institutes, each department has a separate camera for themselves. And the other equipment you need along with the camera. If you are willing to invest into cameras, we have taken this from the internet. I am not a photography person. You will do a little photography course in your first year, and you will figure out which camera you want. Canon is more user-friendly and Nikon is more professional. So it's an entirely personal choice if you're willing to invest into this. I think if each student invests into a camera, it's a better investment. But there are certain lenses and flashes which come along with it, which need to be invested into for even better photography. So this may not be an urgent investment for you. However, I feel if each student buys a camera, the flash can be bought by the department and used. A tripod is your choice. You need, you don't need, you don't need. Okay, camera is a very, very important investment. It stays with you for a long time. Only thing is they keep getting upgraded, but I'm sure like your phones get upgraded, you can also invest into a camera and keep upgrading those. Now, intraoral mirrors are a very good investment. These, I feel you should buy your own. Every student should buy their own, okay, because sharing them is not a great idea. They come in various materials. They come double-sided. They come with and without handle. So we have tried to compile a lot of available intraoral mirrors in the market. Steel mirrors are very nice. Rhodium mirrors are equally nice. Conventional mirrors, I am not such a fan of because photography gives you certain double images at times. Stainless steel gives you really, really nice images. So this is about the mirrors. Okay, a lot of mirrors available in the market, orthodontic mirrors and other mirrors. This is a very nice mirror, which has actually got an anti-fogger and a LED light to it also. So if you want to go here, you can go here. Again, not very expensive. The mirror comes off. You can autoclave it separately. Okay, these are the images with the mirrors, which I have borrowed from Dr. Mohan. Then there is a very important criteria about sterilization. You don't get such good images if you don't have good mirrors. Okay, now sterilization of mirrors is very, very tricky because as soon as you start scrubbing them, washing them, they will get scratches. Your stainless steel will get scratches. So you need to clean and wash them very carefully. They're recommending that you use your gloves and the liquid soap to wash them. They don't even recommend you to use a towel or a sponge. It's not even recommended to wash with that because that will all lead to scratches. Then you dry it, you dry it, you tab it and you dry it. You do not scrub it and dry it. For autoclaving also, wrap it in a paper towel and put it in the autoclave. Make sure that the mirror is completely dry before putting it into the autoclave. Do not wash this in ultrasonic. Do not stack them on each other. And if they chip, discard it. Okay, for when you're taking a picture, for anti-fogging, you can use anti-fog spray or you can heat it slightly, or alternately, you have to, as a patient, to inhale very slowly. Okay, and to prevent watermarks, like I told you, put it in a paper towel before putting them in the sterilizer. This is given somewhere that you use a microfiber cloth. However, they say don't use a microfiber cloth. Don't use paper towels also. So you just dry them. Okay, you just tab it and blot dry them. It's better that way. Okay, some mirrors can be cold sterilized also. The same application for sterilization of mirrors you can apply to contrasters also. So we have to look into the company, make sure how we are sterilizing our mirrors before using them from one patient to another. Let's not use them too much. Contrasters are again a beautiful way of photography. These are various contrasters which are available in the market. You can buy a cheap Capri one, it'll give you decent photographs for now, or you buy a better Photomed one which lasts you for long. Entirely your lookout at this particular stage. You feel you want to buy a cheaper contraster now, you may buy a cheaper contraster now. You can buy an expensive one later. But it's nice to invest nicely into your contrasters so that you get very nice pictures. Okay, even buccal and lingual views can be done with a contraster. You can see the difference there. Then there are cheek retractors, of course, which have to be used for good photography. Cheap retractors are plenty. So many in the market. Pick up what you like. OptraGate is very nice. And there's so many more. So if you want more help here, we can help you. I'll share my presentation and send you all these details at any point of time. With endodontics, mandatory that you have a rubber dam, a microscope, and good mouth mirrors for your photographs and recording here again. These are pictures which come with microscopes. Okay, so what happens with microscope is that first you get very good pictures, but certain institutes, even minimal intervention dentistry, when you want to use, I'm at the end of my presentation now. Okay, you can use only with microscope. Minimal accesses you can do only with microscope. Okay, so for this, what you need is basically very good mirrors. You need a camera adapter. So nowadays, all microscopes come with the camera adapter. Certain older ones used to give you a video camera, which would send it to the television. So then you would don't know how to convert that into a photograph. For that, you should have a TV tuner card. And otherwise, you can have a software which can be downloaded, and the video camera could be connected to your laptop. So there are various ways of going about the microscopic records there. So I have covered almost everything with records here. Okay, I would suggest that you have a folder in your system, in your laptop, okay, where you have everything there, all your LD, your thesis, seminar, journal clubs, okay, your patient records, your special case summary, okay, both have to be present there. So you have everything in one go, and please don't forget to take a backup for it. So I don't know what more I can think about in recording here, but all your special cases, you make folders of it and then you start dumping your cases in that. It really doesn't matter, but put your endo and your restorative separate. You put the aesthetic separate also. We generally club the aesthetics with the restorative. Okay, those are your special case summaries and these are your patient records. So from here, you dump your cases over there. But for every case, make sure that you have a patient record where you have a case history, you have your intraoral photographs, and you have your radiographs. You will start with average pictures. You will start with bad radiographs. You will end up with better radiographs. So when you get a patient back for follow-up, all you have to do is just dump it here. The date and time of your recording comes automatically. With that, I come to the end here. So my take home here is please organize your box files, logbooks, and laptop. These are very mandatory for your 3 years in your branch here. Always take a backup. And with your cases, pre-record, record, and follow up. Do that regularly. Happy documenting to all of you. Thank you so much. Any questions, anything, Dr. Konapa?
None so far. Just wait if any student. No questions have come in.
No, I don't think there will be questions.
I'd like to add in one more few points on this, ma'am. You've covered the topic quite well, especially pertaining to management of mirrors and microscope, considering that we pay a very high amount for equipments like this. Even the slightest amount of touch would create a scratch, which would spoil the refraction quality. I think you did a good job on that particular thing. And also one more point I'd like to add is, as you mentioned about, you always move from bad radiographs or pictures to good ones. Obviously, when one looks into the grades, what you get in your first MDS, In 6 months, one can actually appreciate the kind of evolution of your work. The PG himself or herself is a evaluator for your own work, but you can see from your first month to your third month how your work has improved. Consider the fact that you go on, self-assessing yourself, and the teacher is going to tell you how to do better on your carving, do better on your plaster model work or your restorative work. We can actually self-assess. So the moment you record such things, obviously there's going to be a good growth in your curve. So it's really important that we manage records like this. And one more important point is from a point of view of forensics. In time, in cases mass disasters, obviously these records can be sought by the medical departments or maybe the forensic dentistry departments who would make use of the medical records what we have. Obviously, these will be useful. So thank you, Dr. Mamta, for a good overview of this but very important topic, because I observed even the earlier speakers, that is Dr. Vibha and Dr. Karnaka, both harped on this point about documentation. So you've covered it quite well. Thank you for the good presentation.
Thank you so much, Dr. Konapa. There is a question here in the chat box. I think some student has asked just now. Somebody asked me that is there any documenting software in the chat? I think somebody posted it. Documentation software is not there as yet. We can develop it. Fatima Shanoy ma'am's team had developed an app for that. There are patient management software which can be clubbed here and used, and you can dump all your data into that. So that is one way of doing it. Patient management software are plenty. So if you take a patient management software, it caters for everything, from appointments to everything. But your data can definitely go into a patient management software because it gives you space for a history. It gives you space for photographs, radiographs, and treatment rendered. So there are patient management software. We can think about that.
3 more questions have come in, Dr. Mamta.
Yes.
First one is about the recent advanced technology for mobile camera and the various attachments for documentation.
Mobile cameras actually are shooting very good pictures nowadays. However, DSLR gives you better pictures because there is lesser interference, lesser shadow with it. You can try if you have a very nice, the iPhone cameras are nice, the Samsung cameras are nice. If you've been able to shoot a good picture, well and good. But DSLR is always better.
Thank you. And the third question is related to the same thing, that how far is mobile photography going to help in documentation, or DSLR only is to be recommended? I think you've answered that.
I think so. I think if you're doing a good mobile photograph, you can transfer it and use it. You can, if it's a very good picture, you can use it. Only thing is you still should use your mirrors. You should use your rubber dam and your contrasters for better pictures. And microscope, I think for endo is the best way for pictures here.
That's right. Yes. One more has come in pertaining to intraoral camera. Can we use intraoral camera for documentation?
Yes, absolutely.
I think you covered that.
Cameras are very good for documentation.
There's one more student who has asked a question. Can you finish a first year quota if you're assisting and observing faculty for 6 months?
Yes, first year quota is very minimal. Actually, you will meet much more than your first year quota, even if you're observing. Your observation period should be with your first 4 to 6 months. After 6 months, you should start working independently. Only for surgical work, you have to assist your senior faculty and your seniors, PGs also. Most of the endo departments I know of everywhere are overloaded with work. There is nobody who is attending immediately. Everybody has a waiting list. So you definitely finish your quota. Bleaching cases, veneer cases, post and cores are little of a tussle and a battle between all the PGs because everybody wants to do those. That's about it. I think that is it, is it?
Yeah, that's all.
There's one more question, ma'am. Can you attach camera to a loop?
I am actually not sure of it. Can you help me out, Dr. Konapa or Dr. Mohan, with this?
What is the question, doctor?
Can you attach a camera to a loop? I haven't.
No, I
don't think so.
No, the idea is not for us. For surgeons, they do have that attachment available. But as dentists, we really can't appreciate the amount of work you're going to see from a camera which is attached on a loop.
I haven't actually seen also.
Yeah. On a
Light
loop,
on a loop I have
attach,
seen.
yeah, you can't attach it through a loop, but on a loop is possible. But what you're going to achieve by attaching it on a loop is questionable, because the area of concern for you when you're working will be in millimeters.
Maybe
So
a
that,
video camera can be attached. I don't think a
yeah,
photography camera can be attached there.
photography, yeah, cameras can be attached. It can take video and still images. But then again, what is the idea? Are you going to look at a particular tooth, or are you going to look at the
Overall.
face of the patient? So
Okay.
don't make much of a sense.
Dr. Nitin Mehta has replied saying that you cannot
Cannot
attach
be attached.
camera to a loop. Is majorly into
I don't
magnification
think we
and
should
gyroscope.
attach a camera to a loop. Anyhow, it doesn't really make sense
Yeah,
because
it doesn't make
light
sense.
also will not give you, you won't get good lighting for your documentation either. We have to have decent
It's
amount of light.
difficult. The idea of attaching is for general surgery is okay, because the area covered is large.
Wider.
But when you're going to use a loop, and on top of a loop, makes no sense actually.
One more question has come in. When is the ideal time to start working with loops?
I think
Second,
people should start working with loops right from 4th year BDS.
I would say second year
Or
BDS.
maybe 2nd year
Correct.
BDS also,
You have
yes.
introduced loops in second year BDS,
Loops
preclinical.
is as soon as possible. The sooner you get used to loops and you can't work without loops, I think it's like a rubber dam that it should not be a norm. I was saying talking about it the other day that initially people used to not wear gloves. Surgeons used to say that the gloves will interfere with their working. So how we can't imagine working without gloves? Rubber dam is like that today, that you can't do dentistry or endodontics without rubber dam. Likewise, loops is the next big thing. Magnification is another presentation which is coming up tomorrow. Uh, I think Dr. R.S. Mohan also
Great.
speaks plenty on my microscope and magnification. So this is all going to come in tomorrow. Magnification, loops, and microscope. Everything will be covered tomorrow in detail. However, the sooner we start, the better it is. More precision, minimal intervention if you start working with loops sooner.
Good. That was a fantastic and an interactive session. I should thank Dr. Mamta and Dr. Konapa for giving their valuable time and educating the students on this. We would like to present certificate of appreciation to Dr. Mamta Kaushik
Thank you.
and to Dr. Konapa.
Thank you so much.
Thank you. So we will go with the next lecture. I think Dr. Nagalakshmi Reddy will take it up from here.
Thank you, Dr. Mamta Kaushik, Madam, for enlightening presentation on the documentation of the clinical cases. And we appreciate having this most neglected part being explained and emphasized in the right way. Good afternoon, respected senior faculty members, my colleagues, IACD team, and the budding endodontists. Welcome to the IACD First MDS PG Orientation Program 2020. Myself, Dr. S. Nagalakshmi Reddy, EC member of IACD and professor in Jipulareddy Dental College and Hospital, Kurnool. Before I take the pleasure of introducing our moderator and speaker, please allow me to express my gratitude to Dr. Muzumdar sir and all senior faculty members, and Dr. Chandrasekhar sir, President IACD, Dr. Mohan Kumar sir, Secretary IACD, and complete IACD team for their hard work in planning the most informative and useful orientation session. And with immense pleasure, let me introduce our moderator for this session, Dr. Pradeep Jain, sir, Professor and HOD in Department of Conservative Dentistry and Endodontics of Aurobindo College of Dentistry and PG Institute, Indore. Sir has completed his bachelor's in 1992 from GDC Indore and master's in 1996 from GDC Amritsar. Sir has been faculty in GDC Indore from 1996 to 2006 and a professor and HOD in SIMS Indore from 2006 to 2018. Sir is an editorial board member of Journal of Endodontology and reviewer for the Journal of IACDE. Sir was Vice President of IACDE in 2018 and has been elected as a EC member of IACDE for 2 terms and IES for 4 terms. Sir was invited as a guest speaker in various national specialty conferences held at Jaipur, Amritsar, and PG conventions. Sir was an organizing chairman, co-chairman at the Bhopal IACD National PG Convention and has all organized the first zonal PG at Indore. Sir has conducted various hands-on workshops on basic and advanced endodontics with special area of interest in biomechanical preparation of root canal. Sir has more than 40 national and international publications. Sir is a moderator of various scientific sessions, the recent being a James Gutman during the IFIA conference. Sir is also a scientific chairman at various national and international conferences at APEC, Delhi, New Delhi. Welcome Dr. Pradeep Jain sir for the IACD PG orientation session. I request you to continue the session by introducing our speaker.
I think unfortunately, Dr. Pradeep Jain is not able to log in. So I will be introducing you, ma'am. I have the pleasure of introducing you. Dr. Vinitha Nikhil is a graduate and a postgraduate from the prestigious King George's Medical College, Lucknow, in the specialty of Conservative Dentistry and Endodontics, and is also a fellow of International College of Dentists. A university gold medalist with certificates of honor, a recipient of Best Professor and HOD, the Best Faculty Award. She has published more than 125 research articles in both international and national peer-reviewed journals, and has authored 20 monographs and subject books. She is the editor, board member of several PubMed and peer-reviewed journals. She has delivered many presentations at national platforms. Under her leadership, the department has received Most Productive Department of Endodontics Award at the 6th Gradient Academic Excellence Award 2019. She also maintains a private practice by the name of Dr. Nikhil's Dental Limited to contemporary restorative dentistry and endodontics. Thank you, ma'am. Thank you accepting for this to be a speaker in this program, and I wish you all the luck.
Thank you. Thank you so much, Dr. Mohan, for the benevolent introduction. It's Dr. Nikhil's Dental Panacea. And,
okay.
and good afternoon. It's a very sunny day here in Meerut, and good afternoon, one and all. Jai Hind. And my teacher is sitting in front of me, and Sir Anil Chandra sir, happy Good Purnima. Dr. Sanjay Tiwari sir, if you are there, happy Good Purnima. And happy Good Purnima to all my seniors and my fellow teachers. It's an auspicious day. And in the outset, I really want to thank IACD head office for giving me an opportunity to use this platform. Now, why I am very happy to use this platform, because it's a platform where I can talk to my students. Friends, I talk to my students every day, but here the best part is that I'm getting an opportunity to talk to so many students. And what is better than this? And what is better than the day I'm talking to? Now, the topic which has been given to me is understanding theory, get your foundation strong. Much of the work my teacher, Anil Chandra sir, has done by telling you the scope of this field. The DCI president, our own fraternity member, Majumdar sir, told that has been change, a shift in our own specialty from their age to present age, or even from my age to the present age. A lot of work also has been done by Dr. Vibha, emphasizing about what you have to do. But still, what I mean to say here is that students, now you have completed the NEET, you have qualified it, and you have got the best specialty. As Dr. Mamta has told you, that conservative and endodontic is one of the best specialty because n number of patients which you will be dealing are not present or available for other specialties. And with great power comes the great responsibilities. So for that, if you see yourself, you have stepped from undergraduation to a post-graduation. Now, as the degree is big, the difference is also big. Now, here in this post-graduation, you get a specialized training, you do research work, you gain advanced clinical skill, and thus at the end of your curriculum, everybody expects that you are a master of your specialty. Now, if you want to become a successful or a master of your specialty, you have to get an effective learning. You have to do an effective learning. And we all know that for effective learning, there are basically 3 domains on which you have to work. The first is the cognitive. That means where the mental process takes place, where thinking, reasoning, all are there. Then the affective, that is associated with the feeling and emotion. And then the psychomotor, that is the skill, what you have to do. Now, amongst all these domains, my dear students, the mother of the domain is the cognitive. Why the cognitive domain is called the mother? Because with apt knowledge only, someone can excel both in skill and behavior. If you don't have a knowledge of something, you cannot perform it. You cannot act like accordingly. And that's why today our emphasis will be on this domain. We know in the introductory lecture by Chandra sir, they told that dentistry is an art and science, means you have to perform, you have the skill is required, that means a practice, and the science, that is the knowledge, that is theory. Now, what do you mean by a theoretical knowledge? If we say that it's the theoretical knowledge, it means learning without adopting any practical approach. So if we talk in reference to dentistry, where we have to perform the skill, is a theoretical knowledge essential as a dental student? The answer will be always yes. Now, why it is so that we emphasize on this cognitive domain and we say, no, read this, read that, go through these things? It is because theory presents you a systematic way of understanding anything we want to do. It's maybe related to your subjects, it may be related to anything. And by the systematic way of learning, you get an information about in dentistry about a healthy body, how it behaves, that is a physiology, what is a disease, how it occurs, that is pathogenesis. If it occurs, how you should treat it, what are the drugs responsible to treat it, if we are giving those drugs, whether there are any interactions, and then if you're prescribing, what all lab tests you have to prescribe to the patient if the person is suffering from one or other diseases, how to interpret all these things, all this information only you'll be getting from this domain. And this is going to help you to make a decision that how you should go ahead with the treatment of a patient or for any disease. In addition to it, now how you are getting the systematic information is by getting the replies of what, why, when, where, and how. Now, if you want to learn about any condition, about any disease, you should know what is that disease, why it occurs, when it occurs, where it occurs, and how it occurs. If you know about all these things, only then you can treat that patient. And similarly, if you want to learn about any technique, you should know what is that technique, why that technique has to be used in particular that condition, when to use, and when, more importantly, when not to use, and then where to use and how to use. So all these questions can be only replied by a theoretical knowledge, by this cognitive domain. It also helps you to understand why one technique is successful and while the other technique of treating the same type of disease may fail in those conditions. And then this is the way that you can learn from the experience of others. So you can see that the books, journals, and everything what you will be reading, what are they? They are the work of others. They are the experience of others. They are documenting it so that you don't repeat the same mistake, or you can take the advantage of what they have done and they are getting the success. So theory teaches you the experience of by getting all these information, only you can become a successful dentist. Now, as Dr. Vibha was telling you that you have to do preclinical exercise, then what are the clinical one, as well as the research. All these informations are mandatory for doing all these three things. Because if you don't have the knowledge about this thing, you cannot perform those things. In research also, the theory or the knowledge of that subjects, it gives you the direction how to carry out that research. And once you get the data, then whether it should be validated or it should be disapproved. That all only you can get from the theoretical knowledge of that subject. Now, once you know, my dear students, about the importance of the theory, you should know how to acquire them. So the best way to improve your knowledge is through reading, and that too a high quality source of information, that are the books and journals. It takes years and years to write the books and to express the experiences. My dear students, not only as a student, even as a faculty, I cannot purchase all the books. I cannot purchase all the atlases. I cannot purchase all the journals. So I really urge you people that utilize the departmental and the central library of your institute. They are rich sources. They are high quality sources which are only meant for you. Because nowadays, what we see that people are so much stuck to their internets or to the online things which are available. They don't want to step into these libraries, either departmental library or the central library. If you will not utilize these information which have been provided, why a HOD is going to recommend the books? Why a principal is going to purchase those books, and why our management will invest on books? There are so many books which are available. Step in then and then utilize that. That is I really want to request all of you, because it has become very prevalent not going to central library or departmental library. Similarly, the other thing is that whether the book, if you get a knowledge from your book, what has been prescribed to you, whether that is sufficient, then as Sir was telling, that there is always an update of the subject. You should update your subject. Now, Majumdar sir told that they were doing what they were doing at that time, you are not doing now. Chandra sir told that the restorations which were done on the Black's philosophy are no more existing, are fading, and now we are more conservative. That means that there is always a shift of knowledge. There is always a change of domain. There is always change of principles. So you have to update those knowledge. And that's why contemporary knowledge within your subject, it will always better equip you to make your improved decisions, and it will earn the trust and respect in the people you're working. You're working with the people on people whom you are working. So it is mandatory that you should go ahead with the recent updates also. Now, how you can update your knowledge other than the books? That is by attending the lectures, by attending seminars and journal clubs, webinars, which are very prevalent nowadays, attending CDs, conferences, and using the judicious use of internet. Now, seeking this importance of these update of knowledge, our association is conducting so many lectures, webinars, and in the conferences they are making Then there has been by council, there is introduction of why you should present so many journals or attend so many journal clubs or attend so many journal clubs or present seminars. This is only so that you can update your theoretical knowledge by going through the various journals and gaining the knowledge from other presenters also. Now, here are some tips which you can always follow from that how you should attend a journal club or a seminar or when you are reading the book. Friends, your teachers are your best friends. I'm telling you, there is always, there should be no gap. When academics is concerned, there should be no gap between the teachers and the student. You read something, the teacher will help you. If you don't understand that, please go and reach those teachers. They will help you to understand what that line means, that what is within that line. And also that teacher will help you to tell you what is in between the line. So if you are reading something and if you fail to understand it properly, don't hesitate in talking to your teachers. And even in same way, you can always find a mentor amongst your seniors. A senior is the best one to guide you, I'm telling you. We have been very, very fortunate that in addition to our teachers, we had very good seniors because they can be easily accessible and you are slightly less hesitant to them. And just by simply giving them respect, by helping them to carry out their own works, you can make them your best friends, and they can also help you to understand a lot about what you are reading. Whenever you are attending a seminar, JC or lecture, please always hold a notebook and a pen, because you cannot retain everything. Whenever somebody is presenting, see today people have presented such lovely presentation. It takes so much time, so much effort to prepare those presentation. They gather the knowledge, they compile it, they make a gist of it, and then they present. Why not to utilize the same thing what I'm telling you about the books, that these are the experience of others. Similarly, the presentations also, they are the experience, the hard work of others. Why not to utilize that knowledge to gain or upgrade ourselves? So, and you cannot retain everything in your brain. So you should always carry a pen and pencil. You should read or jot down something which you find important. And even sometimes, as Dr. Mamta was showing, that there was a comparison between various cameras. So that means she must have taken and she must have compiled it. You can take the permission of the presenter. You can always click the pics of that. So that can be used for you further, either to upgrade the knowledge, or it can also help even, like for example, in that how to purchase it or to compare the things. So mere going, has become a habit. And that whenever somebody in the department also is presenting a seminar or JC, the other people will sit and listen. No, it should not be that. You should take out the best of that presentation. You should write down some important points and retain them. Okay. And similarly, whenever you are reading some textbooks, please use highlighters, make flowcharts, make short notes, and what are the points of ponder, always write it down. Because at the time when you will be revising them, or you want to see what are when you're reviewing it, you will not get a proper time to read it again. So why not to use highlighters, or why not to make short notes, and you can stick them on those papers, and you can simply revise them and get a gist of it. So reading and then retaining, because there was a theory which I read long back, that you can only retain something only for 24 hours if you don't revise. But if you revise it within 48 hours, you can retain it for a longer period of time. Many of the time, my dear students, it appears that when you have been told about reading or taking out or about some books or journals, you take it as a bag of responsibility. No, it is actually an opportunity to grow. You take your post-graduation as an opportunity to grow. You have to grow from the standard of undergraduate to the postgraduate. You have to become a master of a specialty. And that's why the attitude matters. Whenever you are reading something, you are attending something, you are listening something, all this should be with interest, with a happy mood, with a passion, because that will change everything. That passion will not, if there is a passion, you'll be never tired. If you have a passion, if you are happy to listen it, you will always retain it. You'll always do it. And once you'll retain it, then that will be converted into a practice. Then one more thing what I would like to tell you, that have a discussions with your friend. It is not only, you should not live like an island. You are surrounded by like-minded people, your good friends, your seniors, your juniors. Why not to discuss something? I remember one day, one of my senior was telling me that during their, when they were preparing for CPMT, at my time it was CPMT. So what they used to do, they were 5 friends, so they used to read one chapter. All of them, they used to read one chapter or one topic, and then they used to make 5 questions of that topic, and they sit together, and those were the 5 difficult questions they used to make, and they used to ask each other. So what happens that they will, in this way they can revise themselves the topic, and if somebody else has missed that thing, it can also be regained. So if you light a lamp for someone else, it will always brighten your path. So discuss the thing, you'll review your thing, and when you will take a lecture in your curriculum, there are that you have to take a minimum of 2 or 3 lectures during your MDS curriculum. So you will then understand that while teaching, you understand better. The things become more clearer. So when you are discussing with your friends what you have read, and then your concept will be more clearer, and you will retain it for a longer time. So always develop a habit of discussing what you have. Don't hide that what you have read. A good group, discuss that I'll be reading this today. What are you going to read? Let's talk tomorrow about this. So that is also a very good way of learning, a theoretical part, or it's a very good part of a cognitive domain. Now, when it comes that is only learning or having a theoretical knowledge is sufficient, no, it is not, because our subject is a skill-based subject, and for theoretical knowledge of a skill-based subject, it always needs to be supported by practice. But Leonardo da Vinci, what he said, that if you don't have a theoretical theory, you don't know the theory of what you are practicing, it's just like sailing a boat without a rudder and compass. And that's why we can say that both theory and practical, they go together. And then how is the way that once you know something, how you can apply it in a clinical way, or how you can upgrade your skill? That is, by knowing the thing, you start your preclinical and then your clinical, and then every day-to-day hand-on practice improves your skill. And there are also skill enhancement workshops, as told by Karnakar sir. Even our association also holds such enhancement workshops. You can always attend them, and they also polish your skills to a further extent. So we can see that both theory and practice, they are practicals, they are interconnected, and they complement each other. So one give you the answers of what and why, and the other give you how to apply there on the patients. So I would just want to say that everybody is very, very much happy in their comfort zone. It's a beautiful place, but nothing grows inside there. You have to step out of your comfort zone. You have to go through your books. You have to go through the journals. You have to go to the magazines. You have to then read it, and then only the magic happens. You'll be upgraded in your knowledge, and that upgraded knowledge can be applied on your patients, and you can really justify your mastery. The onus is, no doubt, it is big, but you people are the future torchbearer of our specialty. And that's why I just tell you that please take this 3-year curriculum very seriously. Because if you'll take this very seriously, you'll make all of us proud, because you'll be achieving everything what we have not till date achieved. You'll be better skilled person. You may conduct out very good researches, and you'll make us proud. Now, I really want to thank the teachers present across nations, because when I asked them that can you give me the gist of books or the books you want to recommend for our postgraduate books students, that they should go and they can upgrade their knowledge, they have provided me almost everybody whom I asked. They have provided me the books, the recommended books, the atlases, the list of topic related books. Topic related books, as sir was telling, Majumdar sir was telling, that now it is not only conservative and endodontics. There have been splits, small things like aesthetic dentistry, regenerative dentistry, surgical, and there has been so much split. Chandra sir was telling that what are the various research platforms. So there are subject topic related books also, which I have received from my friends, and the classic articles. Classic articles means there are these articles, they can really change your view. You can understand the concept very clearly only going through these articles. And what are the journals which you should actually, there must read journals in our specialty. So they have, and I've compiled that list, I've made it. So those whoever, because I've been told that I'll be given only 20-25 minutes to speak, so I have not incorporated that list. It's a big, huge list. You, those who are interested, this is my email ID. You can always email me, and I'll be really happy to send you that list. There's few topics which I can show you that, like, for example, if you want to read about dental pulp, these are the books you can go through. If you want to read especially about the disinfection of the root canals, or dental ceramics, or dental caries, or surgical endodontics, lasers, endodontic radiology, aesthetics, everything, there have been certain sections that you can select, because these are the books that have been chosen by many of our readers, and they have found it very good. So what are my recommendations for you to go for how you should read or how you should enhance your knowledge? And that is that please regularly read your textbooks. It should not be only one day reading. You cannot do it. It's not possible. Your brain is not a sponge that one day it will soak everything. If you will put the sponge on moisture, it is going to soak everything at a time. It's not possible. So it should be a regular reading of your textbooks. You can select any textbooks. There have been recommendations by your teachers also. You can select any textbook. It may be a national reader, a writer may belong to our own India, or it can be any foreigner. It depends upon that which book you can easily understand, the language you are more easy to go through, or which can usually, which is it is written in a way that it is more acceptable to you. So you can select any textbook, but completely read that book. Or what you can do, that you can ask your seniors and your teachers that there are certain, sometimes in a particular book, certain sections are very, very important. They are very well written. You really want to, you can select those sections and they can read from different books. You should always try to add atlases to you, because they also enhances your understanding. Similarly, there are some topic related, as I told you, topic related specific books which are being upgraded, because there are some hot topics which are going, like aesthetic, regeneration. Every second year you will get an edition of it. So you should read those textbooks, topic related textbooks. Then keep yourself updated with the journals. Attend your journal club nicely, because the topic which are presented are selected by your teachers. They know what is going on. Whenever you are in the conference, attend each and every paper. The conference are meant only for you people, only for we people, only for people who want to learn. So if you are registering, if you are going, then utilize it. Why you are not utilizing it? Then utilize your departmental and central library as well as internet, and then always make short notes, flow charts of important things, because you cannot retain everything in your brain, and then discuss with your faculty and fellow PGs. Your faculty, your teachers are really, why are they? They are for you people. Teachers are nothing without students. And if you are not utilizing them, then what to say? You should utilize your teachers. You should discuss it. You should read first, then you should discuss the thing with your teachers. It is not there that in PG you cannot discuss. PG is there is a guided curriculum. You can always approach to them, you can always approach to your PGs. I really want to thank again the head office, the president, and the secretary, our Dr. Majumdar sir, and everybody who has been involved in this program, that he or she has given me the opportunity to talk to my students. And this is again, this is my email ID. Those who are interested can always tell me, write to me, and I'm going to send them the list of all this classic articles, the specific textbooks, as well as the books of various subjects which we have to go through.
Good afternoon, everyone. Good afternoon, everyone.
Good afternoon, sir. Please go ahead.
Yeah, good afternoon, everyone. Excellent presentation. I would like to congratulate Dr. Vinita for such a wonderful presentation. And I'm sure that after all the postgraduates of the country will be benefited from her knowledge and the recommendations. As correctly mentioned by her, theories are important as they demonstrate an understanding and provide a framework for further research. The word theory is quite commonly, as you have stressed, on the cognitive component, the cognitive domain in our day-to-day work. The various learning theories in the educational field indicate that it is more like a set of principles or the ideas that provide an explanation of working of a concept or basis of practical happenings or connections between the various principles in a model or working together. That is very well covered up the entire, I'm sure, the entire country, all those 1,000 PGs, those who are attending your lecture will be benefited. As if you talk about our own specialty, the minimal intervention dentistry is now coming up, as we talk about every day in our, until unless we do not get the sufficient science behind understanding the minimal intervention, then we can't deliver the best possible to the patients. So the theory is always very, very important. And I'm sure that not only the postgraduates, your fellow colleagues and all those teachers who are attending will get certain important points from to be taken up from your lecture. Thank you so much on behalf of the IACD, and I would like to thank the entire team of IACD for giving us an opportunity to be the moderator for this session. Just because of the network issue, I got late by a minute or so, but I thought I should attend the complete lecture and then go ahead and so there are certain questions as appears in the chat box. I'll just go through it. So not exactly the question. That means the topic is very well understood by everyone. It is just a message from Dr. Anil Chandra sir. Excellent presentation, Dr. Vinita, and I would like to congratulate you. And as such, though no other questions, so I would like, if you permit, I can.
Dr. Pradeep Jain, can I say something?
Yeah, please go ahead, sir. Please go ahead, sir.
It is always said that students are blessed to have good teachers, but sometimes teachers are blessed to have good students like Dr. Vinita.
Very well said. Very well said, sir. Very well said, sir. It is perfectly correct that students are also, like the teachers are also blessed having wonderful students, because you also gain knowledge during the interactive sessions in our postgraduate teaching curriculum. Just a small question from my side, if the office permits. the importance of the library dissertation in your opinion, madam?
Thank you, Dr. Pradeep. Library dissertation, actually, to the small knowledge which I have, was introduced so that people, they should know how to write a dissertation. It was actually a preliminary work before they can attempt the dissertation writing and something. Nowadays, what we are doing is basically a narrative review what we are doing. And in few of the colleges, it has been a systematic review or a study with some ROLs and all. But initially it was introduced that a monograph of thing is available in your own library, which you are interested to. Suppose I am interested in only particularly of stem cells, and I want to know everything about stem cells. I can go through that with my student, and then we compile the thing, we discuss the thing, and we can keep it for our own knowledge. So initially it came it like this, but nowadays it has various forms, and Dr. Sonali tomorrow is going to cover this topic, that what is library dissertation, how it should be carried out, what are the guidelines, all these things she is going to present tomorrow.
Thank you, madam. There is a request appeared in the question answer blog. Ma'am, can you please show us the list of the books again? Is it possible, madam?
I can, because it's a huge list. It has,
okay.
It's a huge list, and seeing the paucity of the time which we were provided, I have not compiled the whole list over here in this presentation, but it is available for everybody. They can mail me, and the same will be sent to all of them. Everybody, all the list of the books regarding conservative and endodontics and dental materials and specific topic related classic articles and the journals they should go through. So it's a compiled list. I'll be sending all of them. Those who are interested, they can simply.
Thank you so much. There is one compliment which is appearing into if I the secretary, if they permit, I'll just read it out. Thank you so much, ma'am. As a first year postgraduate, never would have expected that you all would understand our state of mind and explain it in the best way you can. It was an amazing session. Happy Guru Purnima, madam. That is what is one anonymous audience has written a compliment for you, madam.
Thank you to all of you. Thank you.
There is one anonymous one more. This is appearing. The ma'am, is any provision for us to access paid journals at free of cost?
Paid journals. I'm telling you one thing. Although you should always thank Alexandra Devi. If you remember her, Sai Hub, people are utilizing it. See, at our time, we were permitted to go, or there's a very rich library in KGMC. So only those journals we can read. Then Medline came. But nowadays, I could see that even those paid journals, if the college don't have that facility to go through, I will not recommend. I'm not recommending that. I used to see the students using that site that Alexandra is providing almost every article which is there, because she believes, she was a PG, there was a history behind it, that when she was doing post-graduation, she could not access the literature because she didn't have the money. And then she said that there should be no barrier between the knowledge and the student. So, but that site is not recommended because they are hacking something and they are providing. But it is easily available and the students are using that you can almost access all the articles, if not the books, but the articles can be accessed.
Thank you so much, madam. Thank you so much for such a wonderful presentation from your side. I would like to request the secretary, Dr. Mohan sir, to take over from now.
Dr. Nagalakshmi Reddy will be presenting the certificate, sir. Then I will go ahead.
Okay, thank you.
It was very informative and fabulous lecture, ma'am. Thank you for elaborating the importance of theoretical knowledge. Now I would like to present the certificate of appreciation to Dr. Vinita Nikhil, madam.
Thank you, Dr.
Please accept it. Sir, now I would like to present the certificate of appreciation to Dr. Pradeep Jain, sir. Thank you for moderating the session, sir. Thank you very much, sir.
Thank you so much, Dr. Mohan, for giving us an opportunity. It was really an interactive session, and we have really enjoyed attending it. Thank you so much once again.
Thank you, sir. Now I'm handing over to Dr. Mohan, sir. Please take over, sir.
Thank you, Dr. Nagalakshmi Reddy. One part was educational, and one part what I wanted to highlight is a student thanking the teacher, and seldom happens the teacher thanking a student. So I think students will really understand what all this means. It's just not a relationship for 3 years. It's a relationship which you have lifelong. Hope if you get all these basic things into your mind, you will all become better doctors. So with this, we would come to the end of the first day of the program. Abhi picture baki hai. A lot of things are there for day 2. I would like our president, Dr. Chandrasekhar sir, to say a few words, and then we will close today's session. We'll all see you back tomorrow morning at 9 o'clock.
Thank you, Mohan. Thank you for the opportunity again. I'm very happy to have a very good session on the first day. I thank all the speakers today who have spoken and the moderators who have helped them with the program. And wish all the students that they have gained a good knowledge from this today's session of the program. Wish all the association members, the teamwork behind the IACDE, and all the speakers good luck and happy day. Thank you.
Thank you, sir.
Thank you. Thank you.
Yes, sir. So we'll all meet tomorrow. Till then, goodbye.
Thank you. Bye-bye.
Okay, bye everyone. Goodbye everyone.
It was nice hearing all of you.
Same here, sir. Thank you.
Thank you, Narashmi. Vibha madam, unmute करिए.